Hello, everybody. Welcome back to the Science Facts and Fallacies podcast. I am your host, as always, Cameron English, joined again by Dr. Liza Dunn, sitting in for Kevin Folta, who, as I've mentioned several times now, is a new dad. So he needs some time to...
Kevin.
Yeah, it's very exciting. Congratulations to Kevin. There's nothing like it, as I think both of us can attest, right? Having children is very, very exciting.
Absolutely.
Okay. All right. Well, let's jump into our stories. Got three as always. First up is misinformation. Fear campaigns from anti-biotech groups make it a challenge to even keep products on the market, let alone introduce new technologies. Next up, blood dinner. Why are you targeted by mosquitoes, but some lucky few are spared? And finally, Trump of the left, Robert F. Kennedy Jr. traffics in vaccine misinformation, much like the hard right. So that's our least controversial story of the day, Liza. Let's talk first about this first story. This is by a good friend of ours, Dr. David Zarek, who writes for GLP, and this story is for European Seed originally. And he talks a lot about risk assessment and the difference between how Europe regulates technologies like pesticides and how the United States and Canada and some other nations regulate them. So he's always great to read. But here he's talking about the fact that technology, and he's talking about agriculture here primarily, but how technology is solving critical problems for humanity, whether it's access to food or sustainability issues and so forth. But a lot of the companies that are developing this technology are running into communications problems because they're up against activist groups that are very well funded. They're very good at public relations, and that's all they do. They don't have to develop products. They don't have to do really any original research to develop useful things that, say, a farmer wants to use. They just come up with scare campaigns like the Dirty Dozen.
And they profit from them by selling supplements
That's right.
They can vitamin C for a gajillion dollars instead of over-the-counter vitamin C for $4.
Yeah, that's right. And all you have to do is pay for the marketing of a useless product. You don't actually have to develop something that works and then test it to make sure it's safe, which can cost hundreds of millions of dollars depending on the product that you're developing. So this is the dilemma that people in the science community and in industry are facing, is that you might have a great product that does what it's supposed to do and it doesn't pose a risk, but you have an activist group that has a very powerful financial incentive to attack your product. So where does this leave us? The risk is these products are not going to be on the shelves, and companies are going to invest less money in research and development, because if there's a significant risk that the product's going to be banned or you're going to be sued into oblivion, then what's the point, right? Why invest all these resources? Why leave your investors on the hook for something that could fail because of activism? So Zarek's solution here is that people in science have to take the fight to the activist groups the same way that they have attacked mainstream science or the consensus position, whatever you want to call it. And he says you need to tell stories, you need to get out in front of people, you need to be compelling, basically. You need powerful, convincing messaging. But at the same time, you can't be a bully, right? You can't be too forceful when you're talking about sustainability, right? So he gives the example of telling people they just have to quit eating meat. A lot of well-meaning groups that are pro-technology have said that. They've just come out and said, meat's bad for the planet. And of course, especially in America, that message does not resonate very well. And I'm sure in a lot of places in Europe as well. So that's where the story starts. Very curious to get your thoughts on this.
Yeah, I think that's exactly important. And I've been actually calling for more scientific communication for the past couple of years. And we may have talked about this in an earlier podcast, but one of the issues when you are talking about having a really great product that people want to buy because it has some benefit for them, that then on the flip side has an activist group campaigning against and having a very successful PR campaign around it, is that companies, for example, have traditionally had two kinds of levels of messaging. One is the corporate message which is really to sort of say, we've done the research, this product is safe, you can trust us, and it's at that level. And then there's the scientific level, which is a PhD level discussion often, because there have been years of in-depth, really, really tough regulatory studies that have been done to demonstrate the safety and benefits and efficacy of whatever product is on the market. And the scientists will often communicate at a PhD level. And so you have to have a great deal of expertise to really understand what they're saying, even if you're in a different scientific discipline. So what's been missing so far is this middle ground of scientific communication, where people can take deep scientific information and translate it into a message that scientists can understand, different professionals can understand, ordinary people can understand. There's a communication gap in that area. And so there's a huge need for people to learn how to do that. And I guess case in point is really with these COVID vaccines, right? So to give you an example, here we have a massive pandemic that has literally killed millions of people. And the light at the end of the tunnel was the development of this vaccine, which by far and away superseded lockdowns, superseded masking and all of that stuff. It's really saved lives and prevented hospitalization and death. And it works in a way that is really, really fascinating scientifically, and could be leveraged to use in other disease states like cancer, for example. And there are some trials going on looking at mRNA type technology in the treatment of cancer. And you would think that would inspire a great deal of confidence in the product. People were able to get back to work. People are able to, get back on with their lives. Kids were able to go back to school, that these would all be good things. And there has been so much scientific misinformation about this particular vaccine, and it's taken off on social media and things like that, it's really caused backlash. And the backlash, it has kind of metastasized into other vaccines. And how we've handled that as physicians has not been ideal. And I can understand where physicians are coming from in this realm, because they were at the bedside taking care of very, very sick patients, and they saw firsthand what COVID could do. And they see the light at the end of the tunnel, and they're like, oh my gosh, that we can finally have a solution to this problem. And then with all this backlash, when people started asking questions, physicians got upset and lost patience. And unfortunately, that wound up exacerbating the problem. One of the things that happened on social media is open discussions about the benefits and safeties of the vaccine, and questions were billed as anti-vaccine sentiment rather than legitimate questions about the safety. And so unfortunately, a lot of that conversation got shut down. And I think it's very important to be able to have those conversations with people instead of telling people that they are anti-vaxxers or they are non-scientific, or flat out calling them names and doing all sorts of bullying techniques. Physicians also did this to each other publicly during this episode. So, when physicians often have very lively discussions behind the scenes about the best management for a particular patient, right? And sometimes those discussions get intense and we disagree with each other. This is the first time that kind of discussion ever happened publicly. And so rational, understanding physician who's willing to listen to their questions and spend time with them and answer questions wind up hearing this disagreement. And that there's a big, huge seed of doubt in there when those physicians have, equal credentials. So it's a little bit difficult when people are being mean to each other and people are saying that they're smarter than each other and people are bullying, even if they have the right science. it actually creates doubt, and it's problematic. And we need to rethink about how we do scientific communication.
I saw recently on Twitter, it's a very high profile figure in the science communication world. I'm not going to mention any names, but this person was promoting the idea that you don't engage with vaccine skeptics or vaccine hesitant, whatever you want to call them. This person's point was they're just looking for attention. They're trying to promote their message. They're trying to capitalize on your audience. Don't interact with them. And to be frank, I can't stand that perspective. I think it's really, really harmful from the outset to say, let's not figure out the best messaging. No messaging is the answer. I think that's horrible. And we'll revisit this in one of the other stories later on. But it's so harmful because a lot of people, when they go onto Facebook or they go onto Twitter and they happen upon, a Joe Mercola or a Robert Malone or whatever, they're not dyed-in-the-wool skeptics. They haven't been hardened to a counter message at that point. But when they see you go and say, I'm not going to engage with Malone because he's a crank and he's a conspiracy theorist and he's just a grifter, and maybe those things are true, it depends on who you're talking about. But that's really harmful because to that person who maybe was just frustrated at the fact that they might lose their job if they didn't get a COVID shot, they see you interacting with the opposite side of the debate and they go, okay, well, what's this person's problem? What don't they want me to know, right? And that sort of foments the very attitude that you're trying to prevent from spreading among the general public. What do you think about that?
That's exactly right. And if you don't engage with other people who have differing opinions, you wind up in your own echo chamber, and that really solidifies your opinion instead of understanding where other people are coming from. And I think that that's what we're seeing. We're seeing, a huge backlash. The Robert Malone example, he can go out there and say that he was involved with the development of the mRNA technology. And that's true. And so people want to know, who don't have any scientific background, why he's got concerns. And so that's when you have a legitimate scientific discussion that's cordial with people. Now, if the other side, like the true anti-vax side, will come after you and bully you if you, stand up for vaccines. So that if you see that from the anti-vaccine side and you're mirroring that, and you know how that feels, right? Imagine what it's like being on the sidelines, watching legitimate professionals. You have this really condescending and sometimes almost doxing-like behavior, going after people for having disagreements and having legitimate discussions. And I think that once again, at least in this nation, freedom of speech is paramount. And I think that this is an example of how important it is, because if you don't have an open, transparent discussion, you wind up losing actually a lot more and getting siloed in your own echo chambers. And then you don't get the best of the right science eventually.
Mm-hmm. Yeah, I think that's 100% true. The free speech angle is important. We don't talk about that a lot in science communication, but I think it's fundamental because you have to think, and this is the classic, Lockean sort of argument or whatever, or maybe John Stuart Mill, right? If you utilize tools to lock down speech and to silence people, you have introduced into the culture the idea that it's okay to shut people up, and that can be used against you. And history is littered with examples of this. So it's not hypothetical. It's not a slippery slope. As a scientist, you need to consider, and again, just to some people who may be sympathetic to this argument that I'm criticizing here, you need to be aware that this could very easily be used against you. It could be the wrong administration, or it could be the wrong appointee to a Health and Human Services agency. You never know. And so it's very, very important that you utilize your expertise and you develop some communication skills so you can address people's questions or even argue with people on occasion. I think that's context dependent. Sometimes, maybe it's not good to get on stage with, RFK Jr. and talk about vaccines and autism, right? Like Dr. Paul Offit, who we've had on the show. He's at the Children's Hospital of Philadelphia. If people don't know who that is, he's a pediatric infectious disease specialist, but he's written like 10 or 12 books on vaccine safety for the general public. He gives public talks. He interacts with people. He was willing to come on the show and talk to me, right? So he was saying, there's no benefit in me debating this guy at this point because he is trying to amass his audience. I've debunked his arguments ad nauseum, and I'm out there speaking about this. So in that sense, I get it, right? In certain situations, maybe you don't go into a debate, but as a first line policy to say that I'm just not going to talk to these people because they're not worth my time is the worst strategy.
And Paul Offit is a wonderful example of a science communicator. He talks to people who are hesitant and people who actually, really do think that vaccines cause harm. He will take the time of day and spend time answering people's questions very publicly and very respectfully. He doesn't do the ad hominem attacks. He's actually been the subject of ad hominem attacks because he has some questions about boosters. And so I think that really, if the ad hominem attacks are coming from your own group of professionals, that is really disconcerting for people. And it really needs to be a cordial, well-mannered discussion because, with this epidemic, we learned about SARS, COVID, right? We didn't know about it. It was science in evolution, and we were learning as we were going along. And so it's important for people to learn how to adapt to the changing reality of science. If we didn't have any debates, we would still be doing lobotomies, right? If you aren't, lobotomy was the first line treatment for schizophrenia and bipolar disorder, and then eventually got put into all sorts of other uses for depression and a whole variety of things, and it harmed people. And so in 1950, if we would have shut down all debate about it, right, we would still be saying that this is a first line treatment because we need to be able to because you wouldn't have had a conversation about it.
Yeah. Final thing to consider, talking about Paul Offit again, the last time we had him on the show, I proposed a time for the interview and he said, I can't do that. I have rounds. So after I do rounds, and it hit me in the moment, and I'm thinking about it again, is that, he has to go around and check on his patients before he has time to talk to me. So I think that's another interesting angle to this, is that he's a clinician. He's interacting with people on a daily basis. He's answering those kind of questions. And I think that is important because a lot of people in our space, no disrespect intended, they're academics. And so they're surrounded by people that think just like them. And the economist Thomas Sowell talks about this in his book, Intellectuals in Society. And he said there's a reason why the establishment or people in academia, the reason they're often not very good at detecting flaws in their ideas when they're implemented in the real world is because they sit in their university department and everyone thinks like them, everyone talks like them. So you go, you're like, hey, Fred, should we do this? And they're like, oh yeah, that's a great idea. And Fred thinks that because he has the same education and experience you do. Mm-hmm. Whereas if you go out into the real world where those ideas have to be applied, you get a different perspective. And I think that changes the way you think about these issues.
It absolutely does. And that's such an important point because often the people who are left holding the bag of, bad ideas are the people who are at the least able to be resilient about that, right? So, lockdowns really affected people who were, had small businesses that were dependent on an income and things like that. If doctors who are, really, a lot of them are in hundreds of thousands of dollars worth of debt when they graduate from medical school. And if the thought of them not being able to go to work and make money would be a disaster for them. And so because they were so involved with taking care of sick patients, they were having a hard time relating to the everyday person who had a small business. And I think that it's difficult to get in other people's shoes sometimes, and doctors got frustrated. Now, the thing is that often doctors are really good communicators because, and I'll say especially emergency doctors, and the reason why emergency doctors tend to be really good communicators is they are often in very high stress situations where they have to take complex ideas and complex science and explain it to a whole range of patients that are anywhere from kids to PhD level scientists that don't necessarily understand what's going on. So doctors have the ability to be great science communicators, but we need to, as a profession, to maybe look back on COVID and have a little bit of humility about the way we managed our communication around it.
High five, digital high five, 100%. It's such a great point. And I came up with a rule: the next time we're going to have a nationwide lockdown, everyone who advocates for it, you get your salary cut in proportion to the average American who's going to lose their income. That's the deal, okay? If this is life-saving, then your income is going to get cut, and your life is going to be affected the same way that people who you are proposing have to live by this. That's the deal.
Exactly.
That's the deal.
It may be that the lockdown is necessary. It may be, it may not be, but everybody's got to have the same skin in the game.
Right. Yes, I agree with that. Yeah. If you can't pay your car payment, let's see how much you think this is necessary. That's all. And I know people are not going to like that, but that's okay.
Both sides we make everybody mad.
Yeah. Yeah. It was a weird position. And I'm sorry to belabor this, but during the pandemic, I remember writing articles defending the efficacy of the vaccines and also criticizing some of the policies. And so you had people on both sides who were very vitriolic, who would say, you're a shill for the government, right? You're a Fauci lover. I'm like, what? Did you read the article you're commenting on? And then on the other side, you would have people who'd say, you're a science denier and big oil's paying you. I was like, I wish they were, because I could, right? For all the abuse I'm taking for allegedly being in their pocket, I wish I was getting a check. Anyways. Okay. All right. Something a little less controversial, Liza, also very, very intriguing, is this fact that a lot of people are destroyed by mosquitoes every summer. I'm one of them. It's infuriating. Thankfully, I've never had malaria or anything. It's just an itchy red bump. But there are some of us who are spared. And for a long time, I suppose we didn't know why, but apparently this study, and we're talking about an article by Carolyn Johnson writing in the Washington Post. She's writing about a study published in Current Biology. And they did this cool experiment in Zambia in Africa, where they're trying to figure out what attracts mosquitoes to certain people. And so this experiment is really cool. They built this large open air arena, and they piped in the smells of sleeping people. That I don't know how you gather these these scents, but yeah. So they've got the sense of people sleeping in tents, and they're pumping this into the facility. And I think they like put them on hot plates or something. So they heated up the plates, and then I think that releases the scent or something like that. And then they just said, which of these do the mosquitoes go to? And there's still a lot to learn, but it seems that there's a perfect mixture of different chemicals on your skin and in your body, the oils that you release, and it's that mixed with carbon dioxide. There's some magical elixir that the mosquito goes, that's dinner right there, right? And I think there was one person in the study whose odors didn't attract the mosquitoes. And so I think the idea is maybe you can figure out a way to, mask people's scents, and I don't know, maybe at some point you can synthesize some sort of a preventative measure that, almost like an enhanced bug spray or something.
Right? Yeah. Some kind of repellent. Some people, mosquitoes think, oh, you're not too yummy looking, I'm going to go somewhere else. And maybe there's something about their microbiome that is influencing that behavior in mosquitoes. And it's really interesting because this reminds me of a study, and I wish I could see if I can find it. This came out maybe 2 or 3 years ago, where researchers found that stinky feet were particularly attractive to mosquitoes. And so it's probably important to watch your feet. Now, the mosquito really is an apex predator, and that's what this article even mentions. It's the number and worldwide. It's really kills millions of people. And so it's really important to come up with creative ways to prevent insect-borne illness or mosquito-borne illness. So, 3,000 kids come down with malaria every day. And over 1 million people die every year from this insect-borne illness, like mosquitoes, actually, because of the variety of diseases that they carry. And a lot of those diseases, so Anopheles carries malaria. Malaria is treatable, but it's getting to be quite drug resistant, right? So it's hard to treat. It's not an easy thing to treat, especially in endemic areas, because you wind up getting bitten over and over and over again, so it gets reintroduced. And people have co-evolved to be resistant. So sickle cell was thought is a response to makes you less susceptible to malaria. And so people who have the gene, one of the genes for sickle cell, and another normal gene will allele. So one from dad, one from mom. If you've got one of each, one's got a sickle cell trait and one doesn't, you are much less susceptible to malaria. So all of the hemoglobinopathies, the red blood cell disorders that we talk about, are co-evolved to be protective against malaria. So that's Mother Nature's way of making you resistant to malaria. But if you've got other things that you could harness, certain oils that you exude on your skin, or certain bacteria that are part of your microbiome, that those could be harnessed to be repellent.
It's a really big deal, especially in countries like Zambia, as you're saying. I don't remember if it was dengue or Zika, but if a pregnant woman gets bit by one of these disease vectoring insects, their child can die right before they're born, or they can be born with severe birth defects. So a lot of these diseases can do that. So Zika is the classic one we think of, and that really that is a virus that mosquitoes, the Aedes mosquito carries, and that you have to treat supportively. You don't have any drugs that can treat Zika other than hydration, fever control, those kinds of things. And that causes severe brain damage in the developing baby. But I've taken care of women with malaria who are pregnant in Kenya, and oh my gosh! First of all, pregnancy renders you a little bit immunosuppressed, and the reason why is you don't want to have antibodies attacking the baby, right? So you wind up immunosuppressed. In not like HIV immunosuppressed, but a little bit dampened down at your immune system. So that makes you very susceptible to severe forms of malaria, makes you very susceptible to severe COVID, makes you very susceptible to severe flu, and other infections that a lot of people would have, if with their regular immune system, would have done okay with. Then babies can get harmed by that too. Yeah, it's just tragic. And I think this is one of the issues that really gets to me, especially as a parent now. But this is great research, but you have other technologies. You have genetically engineered mosquitoes. Of course, you have insecticides, which, as we've said over and over and over and over on the show, are enormously important. They're one of these technologies that can, in this case, can save people's lives. Yeah. And it's enormously frustrating that a lot of the activist groups we were talking about in the last story, they oppose both of these. DDT is the classic example. And I'm pretty sure the World Health Organization still says in certain settings, DDT is effective and should be used.
Yes, so, it's used in places in South Africa. They paint the walls with it because DDT has not just an insecticidal effect, but it's also got a repellent effect. And it's really important for managing, preventing multi-drug resistant malaria, severe malaria. And so, DDT is still in use.
Yeah. So I think it's the same thing like with, let's say like some sort of pesticide resistance, where the way to approach it is you need different active ingredients, you need different chemistries, but then biotechnology is important because you have multiple ways to prevent the resistance from developing. I think it's the same thing here, right? You have insecticides, you have the genetically engineered mosquitoes, you have basic things like bed nets. You know, all of these things together really give us a chance to save lives and prevent really serious diseases.
That's exactly right. And the bed nets are embedded with a class of chemistries called pyrethroids, which come from chrysanthemums. They're derived from flowers. So we just made them a little bit better because we made them a little bit more stable and light, and made them a little bit less allergenic. And that protects kids from getting severe malaria, from getting dengue, which is a hemorrhagic fever, like Ebola, diseases like that, which kill lots and lots and lots of kids. And if you can imagine watching your child die from a disease that is preventable, imagine how frustrating it is to have a group of people who don't deal with that disease on a daily basis telling you you can't have access to the things that would protect your child. It's really, it's a human rights issue.
Really important stuff. I feel like we could go on and on about that subject. We won't, because I don't want you guys to get bored and frustrated. But I think it's a great example, actually, of what we were just talking about in the first story, which is technological developments make people's lives better. For one thing, they've saved people's lives, but then they allow you to live with a lower risk of disease. So that's a really, really important. Okay. Our very non-controversial story of the day, Liza. This is a story. It's an op-ed, rather, by Matt Bai, writing for the Washington Post. It's called "Trump of the Left: Robert F. Kennedy Jr. Traffics in Vaccine Misinformation, Much Like the Hard Right." So let me just give a quick, I don't know, just a quick qualification here. This isn't a political podcast. We're necessarily going to talk a little bit about politics here, but we're not here to sway you or tell you that you have to be a Republican or a Democrat. I could care less how you vote, but this is going to get a little bit political because we're talking about a presidential candidate. So quick rundown of the story. Bai says that RFK Jr. was once, he's sort of like a level-headed, middle-of-the-road liberal Democrat. He had sensible positions and he was a respectable guy and he could have been a senator or a secretary of state or whatever. But in recent decades, he just kind of went down this rabbit hole. And maybe it started with him being an environmental lawyer. I'm not sure. I don't know what goes on in the guy's head. But I think it was in the late 1990s, correct me if I'm wrong, but he just started going down the vaccine conspiracy rabbit hole, talking about autism and thimerosal and all of these allegedly very serious side effects from vaccines. And this has sort of carried over into his political campaigning, according to this article, right? And they're comparing him to Trump because allegedly he's a demagogue and he's very compelling and he's kind of posed himself as a man of the people. And this is, presumably, according to this story, this is a problem because he can sway people into believing things that are just false. And so this has a lot of people in the press and a lot of people in the science community very, very worried, because even if he doesn't win, and who knows what happens, right? We can't predict the future. He could, become even more popular and more influential, and there could be a large portion of the public that becomes convinced by what he's saying, even if he doesn't ultimately end up in the White House. So let me read this quote, which I think sums up the story, and then jump in here again, because this is, as a physician, you have a lot of insight here. So Bai writes, like Trump, Kennedy is given to skillful demagoguery, casually misleading with the conviction of a truth teller. In a recent interview with a sympathetic host, Kennedy explained how the COVID vaccine, which he seems to regard as a vast evil like opioids or the war on Christmas, utterly failed to stop transmission of the coronavirus, just as the government secretly knew it would. So that's the kind of conspiratorial messaging people are freaked out about that he's trumpeting. What are your thoughts?
So my thoughts are that it's really unfortunate that a person with the sort of aura of Camelot can have this big of an influence on people. Now, I actually listened to his presidential announcement, not the whole thing, but parts of it, and then listened to a discussion about it afterwards, and heard lots of people who, once again, are on the fence about vaccines being very persuaded by him. And the press is surprised that he has got a 20% approval rating at the moment, just in the beginning of this campaign. That's virtually unheard of in early campaigns. And so it tells you how influential he is and how well he relates to people. And his presence has been actually growing over the past couple of years, especially in anti-vaccine circles. And his messaging about vaccines has really, really gotten, should make everybody very concerned about the status of vaccines. He has garnered a following. He travels around with Andrew Wakefield, who is the original author who fabricated a study in 1998 that was published in The Lancet, saying that there was an association between the MMR vaccine and autism. And Andrew Wakefield had a press conference about this. And what he didn't tell anybody was that he had patented his own version of the vaccine to replace the MMR. He had been hired by trial lawyers that wanted to sue pharmaceutical companies. And he thought he was going to make $43 million a year in litigation-driven testing. Meaning he was going to sell kits to patients, and they were going to do testing to find vaccine residues in body fluids, and that was going to be used in court to sue people. And when that was discovered by an investigative journalist by the name of Brian Deere, this is 6 years. It took him 6 years to find out all of this backstory. He went to the editor of The Lancet, Richard Horton, and said, don't you think that this is a problem? These vaccines are kind of settled science. Children are dying from measles because people stopped vaccinating their children after this article came out. And Richard Horton didn't retract the article. He only retracted the conclusion of the article. So Brian Deere took another 6 years, and this is all published in the British Medical Journal. This took another 6 years and discovered that everything in the article had been fabricated. So Andrew Wakefield lost his medical license. He was struck off the British Register, and he moved to Texas, started his own kind of company. RFK Jr. has latched onto that company, and they actually tour around the country talking about vaccines and how they cause autism. And they went up to Minnesota, into the Somali community a couple of years ago. A big measles outbreak ensued. Same thing, Hasidic Jewish community, I think in 2019, big measles outbreak ensued. And people think, oh, measles is a little mild rash. Measles is a devastating childhood illness that leaves you immunosuppressed for at least a year after getting it. And measles it's not just like chickenpox or anything like that. He went to Samoa and talked to the prime minister, and wound up, talking to anti-vaccine activists in Samoa. And a huge measles outbreak ensued in Samoa, and 83 kids died. So to me, it's very tragic that that scientific misinformation was not retracted in a timely manner, and allowed for this thing to blossom. And you've got a guy who can communicate that is spreading this information. And in my mind, it's really, really tragic because babies are dying because of this. And I find it very, very disturbing that the narrative doesn't look at that reality. And once again, we need to figure out how, as scientists and communicators, we need to figure out how to get messaging around that, because I think it's very dangerous for future generations.
Yes. There's a key point here, I think, and it has to do with the framing of the story, because the Washington Post, all the high profile papers, the New York Times and so forth, they all, when Trump got into the election, they all said he's a demagogue, he's a populist, he's a radical, blah 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 blah. He doesn't respect our institutions, he doesn't like the media, right? And then he came out and he said, I'm a man of the people. I don't like the media. I don't like these institutions. And basically, in trying to shut him down, they solidified him as a legitimate rebel candidate. And right, we know the results of that. So I think what they're doing here is the exact same thing with Kennedy. Because I listened to his announcement. I've listened to a couple of podcasts that he's been on, because you have to know your enemy. He's very smart. He's very well read. And a lot of what he says is utter nonsense, but he knows how to mix that in, as this article correctly notes, I think, with a compelling sort of a storyline, but then there's truth mixed in there, right? So he'll say things that are factually correct, and then he ties that to, and also this vaccine will give your son or daughter autism, right? And that's the problem, right? Instead of interacting with him in certain contexts, as I said earlier, and diffusing his messaging, you just try to shut him down. You call him a kook, and all the people who are on the fence, like you were saying, go, okay, well, I know these people at the Washington Post have lied on multiple occasions about very important issues. So am I going to trust these people who seem to, mislead me with no remorse? Or am I going to trust this guy who says that he's not down with these reports, right? I don't know what it is. I don't know, again, if it's being in the same circles, like I was saying earlier, but I don't understand. This is so obvious to me about how you're supposed to address this. And I don't see why people don't understand that.
Yes, I do too. I think you're exactly right. And I think that that's why his message resonates with people, just like the anti-vaccine message is resonating with people. It's what you had in the press was the whole press ganged up against Trump, whether you like him or not. They ganged up against Trump. They went out of their way to dox him. They really went after him in every way possible, right? And people who saw that he got taken off of social media. He got taken off of all sorts of. The people who saw that were like, "Oh my gosh, how can you take a sitting president off of social media?" Right? When other presidents of other countries are doing things that are absolutely egregious, and they're still on social media, right? So by squashing Trump, they actually inspired a movement that is really not smart. And the same thing is happening with Kennedy on the other side. Sorry about the dog.
It's okay. That's life. We have babies and dogs and cats, and sometimes there's noise. I think everybody gets it. It's okay. There's another element to this that is really amusing to me, and that is the Washington Post, as I said just a minute ago, they promote, I guess, what you could call misinformation, because a couple of years ago, they gave a column to Stephanie Seneff and Jennifer Margulis, who are the kookiest of kooky people. And the article was about how a particular pesticide was killing Florida's manatees. And it's utter nonsense, right? So Stephanie Seneff, if you're not familiar, she's an MIT computer scientist. She has no background in toxicology or chemistry or any field that would suggest she should be writing about this topic. And I think Jennifer Margulis is just an alternate alt-health, anti-vaccine kind of a blogger. And so I find it unbelievable that a paper like the Washington Post, and they weren't the only ones, USA Today, Associated Press, the Times, they all did this, right? They give Americans figure-wagging lectures about the dangers of misinformation. It's a threat to democracy, don't you know? And then they give a platform to these people. So I can't take you seriously. If you can't consistently oppose these silly narratives, then I don't care what you think about RFK Jr., frankly, right? Because I'm better at it than you are in that.
That's right.
Yeah.
You have to be wedded to truth, right? And scientific truth is objective, right? Whether or not you agree with it, right? I think what is Neil deGrasse Tyson says something along these lines. I can't remember the quote.
The cool thing about science is it's true whether you like it or not, something like that.
That's right. And that's exactly right. And yes, sometimes you learn about things as you are learning how things evolve, but that doesn't change fundamental reality. And so when you have scientists, quote unquote, from institutions that are being platformed with a lot of misinformation, and you're not letting anybody have a discussion with them about that misinformation, and then you turn around and want to change you agree with a scientific thing, and you won't let anybody discuss that either, you lose all credibility. I don't know if that's clear what I just said, but I think that that's what's happened a lot in the press, is that they've really picked convenient sort of scientific topics and people who they want to support. And if you don't agree with that topic, they just shut you down. And I think that that's why you've had this blossoming of social media and alternative communication, that are literally getting millions and millions of people watching them. These Twitter Spaces, millions of people are watching them, and I think we are seeing a paradigm shift in the way media works, because nobody on either side, or so few people on either side, trust the other side. I may have mentioned this before, but I do a talk called How Medicine Became Monsanto, COVID-19 and Pitfalls in Scientific Communication. And what I try to do is I try to get doctors and public health people together with growers and farmers and ranchers and a whole variety of people. Doctors tend to be urban and liberal. Growers tend to be rural and conservative. The growers are like, well, GMOs and pesticides are fine. They're studied, they're regulated. We know all about this. We've been paying attention to this for 2.5 decades now. This is, this is fine. Whereas doctors are going, well, we don't trust this stuff. They're tinkering with DNA. Half of your experiment, or most of your experiments in medicine, when you're trying to come up with a new idea or new model for cancer or things like that, they use genetically modified mice, right? Transgenic mice are or genetically modified. So the whole research platform behind medicine currently is, or most of it is, a lot of it is based on GMO mice. And we have GMO insulin, right? And diabetics live on that all the time. So medical people don't realize how important genetic modification is for medicine. And they doubt it in agriculture. And so what they're seeing now is, agriculture people and more rural people having big questions about the vaccine. And they're like, oh, this is settled science. This is fine. And so I think it's really important to start building these bridges again and having civil conversations about it, because right now we are on a divide that is not healthy.
Let me give you another example. This is actually from the Post story we're talking about. So Matt Bai, he gives the example of Kennedy going around the country saying these COVID vaccines, especially the mRNA ones, those became more controversial, I think, because they're a newer technology. But he was going around the U.S. saying these were never intended to stop transmission. These are a tool of control, right? The government's trying to own your medical history, or whatever particular points he was making. That was the theme, was that these are not effective. These are a power play by people that don't like you and they want to control you. And Bai's response in the article is, well, the vaccines were never meant to stop transmission. They were just meant to prevent serious disease. And that's the end of the story. And he sort of dismisses Kennedy for this. And my frustration here is that while that's true, the vaccines were intended to prevent death and serious disease. If you read the original Pfizer trial, the very first endpoint was preventing symptomatic infection for, I think it was at least 7 days after both vaccines. So go ahead, please.
Yeah, here's my thought on that. I think that the transmission is a nuanced word. Transmission is, did you test positive for the disease because you've got the virus in your nose? And you sneeze and you transmit it to somebody else. So that there's that. That's going to happen no matter what. That happens with the cold, that happens with the flu, that happens. Whether or not you're vaccinated. The vaccine prevents you from getting terribly sick from that transmission. Now, here's where CDC and a lot of people fell apart. They started throwing around transmission, the word, loosely. It will stop transmission. It's not going to stop you getting virus in your boogers. It's going to stop, but it will prevent you from dying if you are one of the high risk groups. And I think that's the point of the vaccine. And we lost sight of the forest for the trees. And that shows you how difficult scientific communication is.
It is very challenging. But I guess the point I'm trying to make, and I hope I'm being clear here, is that there's some nuances, and you just addressed a very important one, right? Is that, like, even though you may carry some of the virus, you may not be infectious, you may not get sick, And they were looking for that in the trial. So if you're the average Joe and you hear someone at the Washington Post say this, and you do what I did, which took 10 seconds, you look up the Pfizer clinical trial and you see them saying, well, their first endpoint is preventing infection. So obviously at some point, somebody thought that this vaccine would at least reduce your risk of getting infected and transmitting this. And let me give you one other example. It's the CDC in March 2021. They're talking about both mRNA shots, so Pfizer and Moderna. And they say these two vaccines can reduce the risk of all SARS-CoV-2 infections, not just symptomatic infections. And that was a study of healthcare workers, doctors, nurses, people who are exposed to very high amounts of this virus.
Yeah.
So in other words, and I'll stop talking after this, and the trial was very careful. They said, we didn't look for asymptomatic infections. We don't know, at least at that point, we didn't know if the vaccine prevented asymptomatic infection. But there's a lot of information out there that seems to, if you misunderstand it, it seems to support what Kennedy's saying. And instead of explaining this and saying, hey, we probably should have explained this better. You're absolutely right. My bad. Let me correct. Instead of taking that approach, it's just like, this was never meant to stop infections, particularly of the variants. It's like, that's very misleading in the other direction, at least in my opinion.
It's the same kind of thing that happened to masks. So at the very beginning, the messaging was that masks were not beneficial. They had no utility, and that was pushed all over the place. Right? Mm-hmm. They weren't going to prevent transmission and things like that. Within a matter of weeks, that flipped, and then the message was not, well, I'm sorry, we've reevaluated it. It was, well, we kind of fibbed at first because we needed to save masks for healthcare workers. Well, how do you get any traction after that about what's believable? Mm-hmm. Saying that cloth masks work. The cloth masks really don't work. They just don't. And yes, N95s do, and you probably do protect yourself a little bit with surgical masks. I think that there's some benefit to masks, definitely. But don't start out saying there's none and then expect everybody to turn on a dime and then believe you, right? So this is an example of just how badly we got it, and it's unfortunate that. We as a profession are having a hard time kind of saying maybe we need to be a little bit more middle of the road about some of these things, mm-hmm. Without fear of getting completely doxxed or completely lambasted. Mm-hmm. I actually mourn for my profession.
Yeah, it's a mess. I don't think there's a perfect answer. I don't think the problem is individual practitioners or individual scientists. I think the whole system is broken in many ways, because at the very top you have government agencies and you have officials who are trying to cover their own asses, to be frank, right? They're being hyper precautionary because they don't want a newspaper article saying you have the deaths of so many such and such children on your head, right? So whether or not the interventions they're recommending or we're recommending were very effective, they were doing and saying what they needed to protect themselves. And as that filtered down, that resulted in confusion and inconsistent messaging and bullying in many cases. And it was a disaster. So I think that's the ultimate problem.
That's how Trump and RFK Jr. have captured the discussion.
Yeah.
That's because they talk to ordinary people, mm-hmm. And they give them messages that they want to hear. Ordinary people have legitimate questions. Mm-hmm. And ordinary people have felt very beaten up by the government and by scientific institutions. And they've felt like they are being asked to carry a very big load and when they aren't given the courtesy of having a discussion. Mm-hmm. And if you want to really polarize people, that's how you do it. And it's really, I think, it gives rise to a kind of a powder keg.
Yeah. There was a great article, if people want to read it, was in a couple years ago now. It was published in BMC Infectious Diseases, and it was a team of virologists who were recounting what happened during the pandemic and what policies worked and what didn't. And these are very mainstream people. One of the authors, I think, was Angela Rasmussen, who's like there's nothing controversial about her positions as a scientist, but they were going through and they were saying, when people were chanting on social media and at rallies, let them die, in reference to, vaccine hesitant, or when Jimmy Kimmel gets on TV and says, rest in peace, Wheezy, because if you're not vaccinated, you don't get a hospital bed.
That is absolutely counter to the fundamental principles, ethics of the practice of medicine.
Right. Yeah. And the examples going on, but the ones that really got to me were like, your mother died and you can't go to her funeral. But if you want to go to a certain political rally with hundreds of thousands of other people, then by all means, because we happen to share that ideology. I mean, I can't help you. If you don't see why the average person looks at that and goes, these people are lying to me and they don't care about me, that has to stop is the bottom line.
Got to stop. Once again, if this is a disease that you truly feel as an establishment is deadly, which I do, I think that COVID is deadly. You cannot say it's not okay to go to one political rally and it is okay to go to another one. You cannot say people have to be quarantined at home and then you and your friends go to restaurants. You can't. The hypocrisy there is mind blowing.
Yeah.
And it is absolutely transparent to ordinary people what happened, and you're not allowed to have this discussion.
Right.
That's how Trump and RFK Jr. get traction.
Yeah. The most egregious example, you really got me fired up here. I'm sorry. The most egregious example was Gavin Newsom, governor of California. He was a champion of we're gonna mandate these vaccines, even for kids. As soon as the FDA authorizes them for that age group, your kid's gonna get this vaccine, or they're staying home, and that's all there is to it. Now, that's a different argument. We can have that some other time. But within months of that proposal, he came out and joined a lawsuit with the California Correctional Officers Union because they're a political ally of his, and he endorsed or supported their suit to prevent a vaccine mandate for prison guards. So in other words, and I read the court documents. I read the argument they submitted in support of this defense, because the union got sued for this by inmates. And their argument was, and I'm not kidding, I almost spit coffee on my screen. Newsom's argument, and he had California public health officials, supporting this. They said, well, if these prisoners are concerned about COVID, they can get the vaccine. The guards don't have to. The best way to protect yourself is for you to get the shot. And in public, that was the very argument that he said, I'm not interested in that. That's anti-vaccine rhetoric, and I don't believe that. Your kids are going to get this vaccine. Now, and I have to say this because people like they can't think about multiple ideas at the same time.
Yeah.
My pregnant wife got the COVID shot before there was like really good clinical data on that. It was sort of a gamble, but with our doctor's input, we said this is probably the best course of action. My son has all his shots. Vaccines are a lifesaver. I love them. I have no soft spot for anti-vaccine ideology or beliefs.
Me neither.
But again, if you can't see this glaring hypocrisy and how that looks to the average person, and no one, by the way, I wrote a couple articles about this. No one in science media criticized Newsom for this, right? Right. There's lots of articles about the Sturgis motorcycle rally and super spreaders and blah, blah, blah. Yep. But this guy, for whatever reason, and the other politicians were off limits because they were part of the official team, right? They're on our team or whatever. So, yeah. I'm like, that's the stuff that has to stop. If you want people to get vaccinated, you have to shut that down when it happens, or we're never going to win this fight.
You have to be consistent. You have to be consistent, right? And you have to, once again, you have to make the same commitment that you're asking everybody else to. And if you don't, because if you don't have skin in the game, then you should not be imposing that on people. The other thing that people don't talk about, which also got Trump a lot of traction, was Trump did Operation Warp Speed. And there was a whole lot of, oh my gosh, these vaccines weren't tested. These vaccines weren't right. And then finally the vaccine comes online, and there's a complete flip. Right. Oh, well, the vaccines were some of the most robustly tested vaccines on the market. They have a wonderful safety record. They really do. But you can't just say, because you have a political opponent, that something isn't scientifically valid and then turn around and say, oh, whoops, we take it back. It is scientifically valid. And if you use the same arguments that we did, you are now an anti-vaxxer.
Yeah. Yeah.
Right. And you're right. These discussions are not being had anywhere, and ordinary people are being just decimated by it.
Yeah. Yeah. Since I love my governor so much, I'm in California, by the way. He was one of the most prominent people saying, like when Warp Speed was going on and Trump was, I made the vaccines at the very best. Like when he was doing that stunt, a lot of politicians came out, and Newsom was one of them, and said, we're going to have our Department of Public Health test these independently because we can't trust Trump's FDA. Now that's just utterly absurd, right? The idea that it's like saying, your Pee-wee baseball team, right? They're going to take on the San Francisco Giants. It's like, no, they're not. No disrespect to the California Department of Public Health, but you're not the FDA, right? You're not set up to do that kind of a rigorous review of a new drug.
Especially in the middle of a pandemic.
Right. So there's the hypocrisy, but then there's the fact that you are saying this institution that's designed for something else is going to be testing this vaccine. I mean, because what you're saying is, I don't trust the FDA.
And then you expect everybody to trust them.
Right.
It's once again, I just think that when you start politicizing science, you wind up losing everybody, and science becomes a huge casualty when you start politicizing it. And that's precisely what happened in this. And it's been terrible for the world. It's been terrible.
Yeah. It's a very good point. So to wrap all this up, I think, at least, and you can speak for yourself, but all I'm saying here is you need to consider how your messaging affects the people that are going to be reading it, and how it's going to be capitalized on by your opponents, because you may get a pat on the head and you may get plaudits for saying this guy's a conspiracy theorist and he's a populist and he's a right-wing crank, blah, 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 right? You're going to get high fives from your colleagues for that, but that's going to accelerate that message. And I think we've all agreed, or at least you and I have here, Kennedy's crazy when it comes to these medical questions. This is very, very harmful stuff, and it kills kids. This is awful, right? So the quicker we can get him away from these topics, and ideally taking up gardening or changing like a real profession, the sooner the better, right? I don't want him in the public spotlight, but I think that's the key, is you have to realize how the messaging against him is in many ways accelerating his success. So
it's enabling him. And I think that we've got to really be very thoughtful. Nobody thought Trump was going to win. We've got to be very, very thoughtful about this.
Mm-hmm. Very good. All right. Well, we'll leave it there. Thank you for joining us. As always, we'll be back next week with a new set of stories. In the meantime, follow us on Twitter at Dr. Liza MD, at Cam J English. Follow Kevin, by the way, because he's still on Twitter, even though he's at home right now. He's awesome.
He's a great tweeter.
Yes. He's very good. And by the way, Kevin, and he's sort of humble when it comes to this. He's very good at sort of striking that middle ground. He'll get on Twitter, and he's talked about this on the show. It's great. Someone will post a story or post a study abstract, and he'll go, hey, look at the methods section. And what do you think of the testing they implemented? And they have no idea because they're not actually reading the paper. They just Googled the abstract. Right.
That's right. They see the headline.
Yeah. So in other words, if you want a master class on how to do the stuff we're talking about, Kevin's doing it on Twitter. So at Kevin Folta, Genetic Literacy Project, they are at Genetic Literacy. Thank you to them, as always, for putting the show on for us. And with that, we will see everybody next time.